Hi, I'm Dr. J.V. Srinivas, head of the orthopedic department at Aster RV Hospital. So this is regarding patient who was admitted under us for the shoulder care. This patient is 57-year-old female patient, had a history of convulsions or epilepsy. This patient sustained a sudden onset of convulsions at home. She was so violent during her convulsion, she landed up having a severe shoulder pain and dislocations. When the patient was brought to us, she was unconscious due to into the casualty after a severe convulsions, and the relatives had to rush her to the emergency. The neurology department took care of her, admitted in the neuro ICU, stabilized her convulsions, made sure there's no repeated convulsions after the admission. Then they involved the orthopedic department. When the patient became conscious after a couple of days, she started complaining of shoulder pain. Then the neurology department called us to take care of the shoulder. When we went and examined her, she had both her shoulders dislocated. Because of the violent convulsion she had in the first episode, it was so violent, all the muscles around the shoulder joint, except the deltoid. Deltoid is a big muscle what you can feel. Normally we all can feel, whereas the small muscles, that is supraspinatus, infraspinatus, subscapularis, and teres minor, these are called rotator cuff muscles. They were completely torn off and the shoulder was in dislocated position. Then we subjected her for an MRI scan of both the shoulders. We came to know in that all the muscles, small muscles around the shoulder joint or the rotator cuff muscles, everything were torn, peeled off with the bone, that is bony avulsion what we call, and it was beyond the level of reconstruction of this rotator cuff, what we call rotator cuff repair. A patient having a convulsions or a seizure episodes, if you do any reconstructive procedure on the shoulder, very high chance post-operatively they'll have convulsions or seizures, and all your surgery will go for a failure. All your fixation will fail, and again they'll have dislocation. So in this case, we waited 4 to 6 weeks till she became convulsion free. And once the neurologist suggested or examined her, got a EEG done, and then they said the brain activity is low, and then she may not have any further episodes. May not have, but it can have any time, but they clearly said it may not have because of the EEG finding. They suggested to go ahead with the surgery. We do partial shoulder replacement, total shoulder replacement when you have the rotator cuff muscles are intact. All the muscles should be intact around the shoulder joint so that you can only replace the articular surface. When you don't have muscles, very high chance that the shoulder is totally unstable. To counter this or to overcome this deficiency, reverse shoulder replacement is done. The ideal indication for a reverse shoulder replacement is absence of rotator cuff muscles around the shoulder joint. This was an ideal indication. Patient was elderly, 57 years, female patient, post convulsion. Now she was convulsion free window. All the muscles were torn and she was medically fit. And since it was bilateral disease, we convinced us to undergo a surgery on the right side. So after the discussion, patient relatives and patient were convinced they wanted surgery on both the shoulders, reverse shoulder replacement. But we told her that she has to undergo only on one side, undergo physiotherapy for 3 weeks. Once she is totally comfortable on the operated side, if she is happy with that, she should come back for the other side. So in this case, we subjected her for a right reverse shoulder replacement. Reverse shoulder replacement is not a common surgery, it's a rare procedure. The surgeons and the surgical team have to be trained for that because the implant is very expensive, surgically demanding, and post-surgery care is very, very important in this case. And if your implant fixation is not good, very high chance that patient may land up in dislocation. If the patient has dislocation after reverse shoulder, it is dead end for the treatment of the shoulder surgery. In this case, we planned the entire surgery. We took her to the operation theatre under the general anesthesia with the help of neurologist supervision. We operated her. We did a right reverse shoulder replacement. After the surgery, she was asymptomatic. On the second day, patient was mobilized with the help of physiotherapists. All the physical activity was started. Yes, for 3 weeks, we restrict the patient to do heavy weight lifting or heavy physical activity, but mild activities like eating, brushing their teeth, washing their face, wearing their dresses, all are allowed. In a matter of 3 weeks, once her muscle strength is back, she gets back her full movement, we allow her to do all the activities. At the end, to conclude, reverse shoulder replacement is a rare surgery not done in many hospitals, and especially with a patient having a convulsions. This is not a routine surgery. In our center, we have done this, and quite a few surgeries we have done of this kind because this is a rare procedure. The implant is expensive, surgical technique, and the post-operative physiotherapy. Luckily, on this patient, the surgery went on very well. Post-operatively, she was asymptomatic. There was no convulsion, and she happily got involved in the rehabilitation. And patient is doing extremely well. I just want to encourage people who are having this kind of diseases or the rotator cuff deficiency and having severe instability, need not worry about it. Come to us. We will take care of it. We will assess it. If possible, we will do a reverse shoulder replacement, and you can get back to your normal lifestyle and normal activities of daily living.